Hey Doc, what's going on?
Hello.
Happy
Good.
Thursday.
How are you?
Good, good, good. How's everything going? All right?
Going good so far.
Good. Just keep at it. Um, at the end of the day, there's only so much you can do, right? So
Yeah.
that's why I hope you know this. You have to figure out what the best step is, right? How to
Mhm.
push, what to do and not to do, how to do certain things, right? How to maneuver around certain situations, right? So tell me, how you feel about everything? I'm so
Overall, I feel like I'm good. I think it was just like the beginning when I was starting to do the full blocks and stuff. I was like kind of not where I am, but I'm slowly starting to see it more of an increase as I'm getting used to doing the full blocks.
sure, sure,
So
sure.
that kind of gives me more hope because when I first started, I was like, what is these scores? I don't feel like it was there, but I think I just have to like train myself to slow down and just focus on what the question is asking me because I've
That's it.
noticed I'm doing a lot better slowing myself down than freaking out with the timing.
I mean, think about it. At the end of the day, guys, you got to figure out where your strengths and weaknesses are, right? I've been doing this for 10 years, and that's why, honestly, there's many companies out there that help you with the content, but there's not that many people helping with test taking, like you said, right? Timing, management, not reading too fast. How many times you get questions wrong that you realize, man, if I just slow down, I probably would have been able to get it right. See,
Yeah.
so it's tough. And hope you know there's so much information. So if you're at this point where you feel frustrated, I get it. I'm here to show you with all these sessions, morning and afternoon, where to get the points to pass, right? Whether
Hmm.
you're in medical school now or you finished medical school, you're currently in there, or you have maybe a break, or whatever the case might be, you have to understand that you can't take everything of 2 years of basic sciences in a couple of weeks, right? But I can show you how to pass the test. You just got to stick with it. And I hope you guys show up every day, morning and afternoon. This afternoon, we're doing hematology oncology, right? In one full month, we cover organ systems twice, cover biochem, microimmuno, four times. So welcome aboard, guys. Today, we're doing hematology oncology. Dr. Singh, how do you feel about hematology oncology?
I feel like I'm pretty good with it. I mean, there's like few questions like I tend to trip up on usually like the pathways
Sure.
because they're hard to remember all the time,
Yeah.
like just to keep it consistent, not mixed up in my mind. But I
Okay.
feel like overall, like with the iron deficiencies and stuff like that, I feel like I'm getting better with those. I used to
Cool.
have an issue with like the AML, CML stuff because I kept confusing them, but it's like I started making a chart and that helped me.
I mean, think of it this way, and for those of us joining today, thank you to see some of your faces here. Welcome. Ideally, what we do is we use Amboss, right, to really much show how to really focus on the key points. Like for example, hematology versus oncology. Heme, you have ALL, CLL, AML, CML, right? We use age trying to help differentiate, plus certain key components. So don't try to just reread everything. Try to figure out how can I differentiate. Like when we do GI, we have certain bugs that cause watery diarrhea and some cause bloody diarrhea, right? When you hit kidney, which we do twice a month, we have nephritic and nephrotic, okay? We have dilated versus restrictive cardiomyopathy. We have preload, afterload. See, so if we use this technique, I promise you will get points and pass. But if you just try to do it all, I mean, I don't know about you guys. Maybe you guys want to tell me in the chat when is your exam coming up? Is it 6 months from now? Then you have more time to cover everything, right? But mainly we're on a time crunch. So today, for example, let me ask you this, Dr. Singh, and
Mhm.
please, guys, if you want to participate, you can raise your hand virtually, jump on, and I will do questions with you. Other doctors just want to sit on the back end, participate, listen, and then be proactive, typing away the answers and or sharing mnemonics and whatnot. Dr. Singh, when it comes to hematology oncology, where do you think you can get points on the exam? Any idea?
I think the easy points kind of do come from like knowing like the factual things. Like, for example, if we're talking about like oncology, like just knowing the translocations or the specific like protein fusions and stuff like that can easily get you those points.
100%, right? And if you think about it, we have medications which aren't our friends, like Farm sucks, but Farm is where you get points overnight. Now, whether you're using Amboss or UWorld, I love Amboss. You'll see why I love it, because it helps you focus train. Either way, QBank is amazing. Amboss versus UWorld. The NBME is nothing like the actual exam, like we did earlier this morning. And the free 120 is the test we take before the exam. So, may I ask you a question, Dr. Singh? Everybody else here participating? What do you know about the oxygen, the hemoglobin dissociation curve?
Hemoglobin dissociation curve, okay, that's like the oxygen saturation.
Yeah.
So the closer to the left it is, the more saturated, the further to the right, less saturated.
Good, right? So you know that, right? So let me have I have multiple screens, guys. So if you see my eyes, one screens behind you, so I could do something like this. This is something where I say we get points. Of course we do. Now, some of us, I think most of us know this. I think this is very familiar, but when you are in med school, everything is spaced out. When you're studying for USMLE, everything's kind of condensed, right? Fast, 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 and a lot of information. So we know what goes right versus left. We should, right? We have right shift versus left shift. Okay, this is exactly what I mean. If you know what causes right shift, by default, things cause left shift. Do you agree?
Yeah.
Okay. So now we have a question coming up, for example, this. I want you to attack the question. And again, we're all here participating. Think of these sessions as workshops. Eventually, I'll see everybody one-on-one because I want you guys to be able to understand that these sessions we have are to see know versus what you don't. If you haven't done heme oncology yet, it's okay. Take notes and figure out when the time comes to do it. Are you familiar with this stuff or not? And these sets here are for your access afterwards. I share the list in our training hub online community for you guys to participate and use. So let's try this question. Let's read it out loud. Usually last line, it's a small little scenario. Let's attack it and see what you can do.
Okay. An investigator is studying the effects of tissue hypoxia on skeletal muscles. Skeletal muscle hypoxia is induced by decreasing oxygen delivery to peripheral tissues. Which of the following is most likely to achieve this desired effect? Okay, so I'm thinking it's going towards like a right shift.
So let me ask you, we have left shift and right shift. What does it mean? Because it's asking, saying skeletal muscle hypoxia is induced by decreased oxygen delivery, which means we're not delivering oxygen to the tissue, correct?
Yeah. So
Which means
that
we're
might,
holding on to the tissue, to the oxygen, right?
oh, okay, then it would be a left shift.
I mean, and again, be careful. We all have to understand if you're in med school now or graduated or a couple years out, whatever the case might be, the questions we get in school are nothing like this. Writers, doctors, MD, PhDs write these specifically to play with us. So decreased oxygen delivery. That being said, we got to figure it out, right? Well, it's not delivering oxygen to the tissue, so we're holding on to it, which means the left shift. Okay,
Yeah.
so look at the answer choices. Do we have an idea of what's going on here?
Left shift, I know, would increase pH. It would, um, and so it
When
was
you
more
say increase,
alkaline. You
when you
would,
say increase pH, what does that mean?
it would increase pH, like it would make the, like, it'll
Is
be
more acidic or basic?
more basic.
More basic, yeah. So if it's more basic, then hydrogen ions go up or down.
Yeah.
Do they
So
go up or
then
do they go down?
they would go down.
They go down, right?
So
Okay,
B
good.
would be out.
So B would be out. Good. And by the way, test taking skills, here it is. If you do not know what the answer is, I can promise you all of these are literally fruits and vegetables. They're all fruit, but there's one vegetable, meaning all these answers are shifting the other direction except one. You just need to know which one it is, right? So
Yeah.
this is out. All right, guys, be active in the chat, man. We're here to help each other out. Let's do it. How about this
Okay.
one?
C, it would be increased fetal hemoglobin, not decreased.
Correct. So this would be a shift to the right, not left. Okay, keep
Hmm.
going.
And then D and E also would be, actually, wait. I know CO2 increases with the right shift. Temperature would be decreased for left shift, so E is out.
So, okay, E is out. And again, if you don't know this, we have a problem. You can't answer the question. So some instances, we need to know a little bit more of the material. You need to know something. Okay, so
Mhm.
this is a right shift. And this one is,
This one is, I think, right shift as well, so then A would be the answer.
cool, there it is. So again, we're working as a team here. Some people might find this easy, others hard, and then this other, or it's reversed. We're here as a community to help each other out and to be active and to push each other forward, right? Support. So in this case, it can trick easily if you misread it, but then here's what happens. Think of it this way. If you misread that, like for example, you thought maybe it's right shift. Then you said, well, if I'm right, looking at the answer choices, do I realize these are all right shift? Like, uh-oh, that's how you catch yourself, right?
Yeah.
It's not with every question, but many questions, this happens where it's like, I kind of misunderstood the question, but I caught myself because all the answers are hitting right, which means, oh, I got to go left. There. So there it is. Great picture. I actually like this picture a lot better. The first aid had something similar in the past. So I hold on to old PDFs and books because I like to look at ones to see which one I like. Clearly, if it's updated, doesn't mean it's the best. Change pictures all the time. Anyway, it's a mnemonic symbol. But this is pretty awesome because using Amboss, it's right here. You see the green line, right? Decrease oxygen affinity, which means you're letting go. So this is everything up. High carbon dioxide, high temp, high hydrogen, which is obviously acidic, low pH. This trips up a lot of people. And a high 2,3 BPG, right? There it is. Versus the opposite. So let me ask you, Dr. Singh, you know me already, go back a while. What would I tell our new doctors here participating today, for example, when it has two different sides? What do you do to make sure you don't switch it?
For me, I usually use the mnemonic cadet to kind of
Okay,
help with that. And I know that if we're going to the right, everything is increased except for pH. And then if it's to the left, everything's decreased except for pH.
cool. So basically, learn one side, the other is the other. This has been passed on like, literally generations. Even when I was studying, Bolgin, Dr. Goyan goes, don't memorize both. It's been proven under stressful time and pressure, you'll switch it. So if you know one side, the other has to be the other, right? Because there's one or the other. So learn right, left is left. It's that simple. These are the points you got to get because there's going to be experimental questions on the exam. Questions are look like it's a whole different language. You're like, is this even English? Those you don't panic, you might get wrong. Okay. These you can't get wrong. These points giving to you, right? But if you don't remember it, if you forget it, you haven't reviewed it, it sucks. Yes, it does. So the other ones are right shift. This is left. This is 1 for 5. You do one answer, you read one answer, you get 1, 2, 3, 4, 5 answers back. This is how you maximize your time in a short time frame. This is how I've had people pass in 30 days or less. The basic foundation, decent foundation in basic sciences. I push them hard and review a lot. By doing this exact formula, there's no way to fail. I do it any other way. It's gonna be a little challenging, right? Just because you got to cover a lot in short time, right? So try this one. And again, if you have any questions, please raise your hand, answer, ask away. You have, like Dr. O did, you just put the answer in the chat box. Let's keep pushing as a team. Hematology, oncology. Let's do this stuff. Let's attack it.
Okay.